Hi there, my name is Dan Bosy. I'm a physiotherapist and fellow of the Canadian Academy of Manipulative Physiotherapy. I've been a member of CAMP since 2006, and today I'd like to talk to you about a condition I see relatively often in my practice. Often patients will come in and they'll complain of lower back pain on one side of their lower back. That lower back pain will often radiate down the back of the leg, through the side of the leg, or even down and through the inner thigh and groin area. They will often complain of pain, weight bearing through the affected side. They'll also complain of pain when they walk, and it gets worse when they walk faster. If they lie flat on their back, they will also complain of pain. Not necessarily right away, but often it will come on within a short period of time. In addition to that, they'll have difficulty going from the sitting position to the standing position because the joint doesn't want to move in that position. This condition is caused from a fall or a car accident in which they fell and they landed on their buttock, causing the pelvis to rotate backwards. Or if they're in a car accident, usually they're the driver or passenger in which the affected side is the side in which their seatbelt attaches. And the seatbelt pushes against the pelvis and rotates it backwards. As a CAMPT-Certified Physiotherapist, I can help you get better, recover faster, and be healthier. A person who comes in with these complaints will receive a thorough assessment in which we would confirm or deny the problem is the pelvis. If the problem is confirmed to be the pelvis, as well as other things that may be going on as well, we would end up doing either a manipulation, mobilization, muscle technique in which to help get the joint moving better. So one of the ways I use to mobilize the pelvis is by use of wedges. The wedges are used in order to help accentuate the rotation of the pelvis into the direction in which it can't go. So now that the wedges are in place, I'm going to put my hands onto the pelvis, one hand on one side, one hand on the other side, and just very gently gap open, so open up the pelvis, and then very gently put a little bit of pressure just to accentuate the rotation of the pelvis into the direction which it can't go. I would hold this for several minutes and wait for the tissues to start to be able to move more and this joint to be moving more naturally afterwards. And easing the pressure gently at the end, and afterwards I would take the wedges out and reassess to make sure the pelvis is moving correctly. And rotation is restored. After the joint has been mobilized and moving, or manipulated and moving, I would teach a few exercises which would help me be able to maintain the mobility of that joint, as well as be able to improve the flexibility and strength and stability of the person's lower back. This would allow them to be able to return to function and get back to their regular activities. If you're having one-sided lower back pain and you'd like my help, you can reach me at dan@awakeninghealth.ca or 905-335-0372.
CAMPT-Certified Physiotherapists have received internationally recognized training in hands-on therapy. We can help you get better, recover faster, and stay healthier. So if you want to stay active in the things you love to do, then look for this logo. For more information on how to find a CAMPT-Certified Physiotherapist, visit www.manippt.org.